Hi, good day. Welcome back to our channel. We have a very interesting gentleman here today, Michael Averbukh, who would hopefully answer many of your questions. Many people ask us when they move over, one of the biggest topics is healthcare, and Michael is going to answer some of your questions today.
I hope
Welcome,
I
Michael.
can.
I'm sure you will. Michael, can you tell us a little bit more about yourself and Serenity, please?
Sure thing. Well, I am a medical doctor that chose to live in Portugal for the past 5.5 years. And together with my co founder of the company, we started a great service called Serenity. Um, we started with the idea of providing a medical concierge service, but quite fast learned that we're doing much more than that. We like to call ourselves your health fiduciary, somebody that you can really trust and deposit your health care um, and, live free of worries when it comes to your medical concerns.
Which is definitely needed here in Portugal.
Which is definitely needed in any place, but it's much more definite when you come to a country in which the healthcare system is something that you're not acquainted with, you don't speak the language, you don't know the culture of the physicians, and you have this pill that you need to take and you don't know who will prescribe it,
Oh,
right?
what's the name?
Or the local name, or does it just sell over the counter or whatever else? It's as small as that and as large as somebody that really comes with a chronic, serious medical condition and he cannot just wait for something to happen because he cannot skip the next treatment. So it's smaller things, bigger things, huge things.
And how does Serenity help with that? If somebody moves over from another country, they feel we've sorted out our health insurance, we are all okay, and then they come here and they have a claim. And as we've seen with some people, it doesn't pay out as they expected. Is that something that Serenity also help with?
So that's the thing. This is a tiny bit of what we can assist with. Many people are wrong to think that if they bought a health insurance, that's it. And it's at the end of the day, health insurance for sure in Portugal is a financial enabler, not more than that. It's another card that you might have in your Apple Pay wallet, right? This is it. It only pays. It doesn't do anything else. And if you want to find the best suitable physician for a certain process, if you want to understand that you're going to the right place, if you want to understand how to use your insurance, either you go to Facebook or you ask your neighbor or you ask on other social media groups. The problem is that what you get are responses to somebody else's problems. And it's never your problem that you get a response to. And if you want something that is tailor made to your specific needs, yours or your family's, if you want somebody who knows you not just as a clinical case of needing a prescription of X, but rather as a person that prefers female or male physicians, that prefers to know everything up to the or down to the smallest detail about your upcoming surgery, or you don't want to know about anything, just tell me where to go. This is what Serenity does. This is where Serenity becomes a crucial partner, a trustworthy partner of your medical journey. Because what we do is assign a case manager, always a medical professional, that takes full ownership together with you over your medical needs. And this is a vast difference. It's a difference between somebody that just can look at an Excel table and tell you, oh, cardiologist, yes, we have one Dr. Joao. It's always Dr. Joao, right? We have a Dr. Joao in Hospital de Couve or Hospital de Luz, and a case manager that says you need a cardiologist. Why? What is the problem? Because there are many cardiologists, and not all cardiologists will be suitable for your specific need. And not all cardiologists will speak English. And not all cardiologists, within those that speak English, that understand your specific clinical problem, will be the ones that would suit your character as a person and would sit with you for 45 minutes and explain with a drawing exactly what are they going to do. And this client experience you can't just get from Facebook.
No. So at Serenity, do you go with the clients? Do you take them to English-speaking doctors? Because I just had an event this past week. I speak a little bit Portuguese, but not too much. I can say doi, which is pain here and there with the children. And then the doctors start explaining to you what is wrong, and they have 10 other people in the waiting room, and you're like, oh, what did they just say? What is wrong? You know, with my little broken Portuguese, I understood a little bit. So how would you help a client in that situation?
So here's the thing. To answer to your question, if needed, we go with the patient to a certain appointment. Happily, we didn't need to. We are on the grounds for almost 6 years now. We have great experience with hundreds of physicians, and this is exactly the thing. When you had an issue with your kid, we would probably refer you to somebody who is fluent in English, because we understand that, again, with all due respect to your Portuguese, even my Portuguese is not enough each and every time to understand everything that the physician tells me. Speaking Portuguese is not speaking
medical Portuguese.
Native medical Portuguese.
Yes.
So it's totally different ballgame. But what we would have done is to refer you to a physician that would have the time to sit with you because of the language barrier, whatever, and naturally would speak much more of an English than of a Portuguese. So you could understand and you can walk at least released with the kid out, and more than that. And this is another aspect of our service. When you walked out, even if you understood everything, you might have forgotten something. Or you heard everything, but you overheard the length of the treatment. And if you just wanted to come back and ask another question, so you would have to schedule again or call again or whatever and come again and sit again in line and wait for the doctor again, etc. No. So you call your case manager, again, a medical professional, and if it's just the length of treatment, we will tell you, you don't need to go to the doctor because the length of treatment for this specific antibiotic is a week. That's it, finished. Or, as these physicians that we would normally refer to already know us, and relationships work even in medicine, we would just call and say, hey doc, remember the client that we sent? She had this tiny little question, and we are asking as medical professionals, so we will not ask him just for the sake of, I don't know,
wasting your
just
time,
waste of time, but really, this physicians understand that we assist them.
Yeah.
This creates a non-parallel or non-existing system, at least non-existing in Portugal, non-existing in many other places, but non-existing in Portugal, a system that supports you and you're never alone.
That's very good, especially for somebody who doesn't understand and being in a new country and so many differences. How about prescriptions? Some people come with prescriptions from other countries. Is that something that you help with as well? Or?
Absolutely. Happily, I would say that in more than 95-97% of the times, medications normally coming from the US or the UK are available here. And if not, we would assist with finding with the proper parallel. The worries around prescriptions are many times unnecessary. I'll share with you something just this morning. A woman that came with, actually, no, she came healthy. Soon after arrival, she developed a problem for which she needed medications. She even went to a clinic and they told her something. It was a very vague interaction, wrong type of first interaction with a client. But her understanding was that she is not eligible to be treated in this clinic nor to have a prescription because she still didn't have a local health insurance. A totally wrong perception, imported from the States. But again, nobody spoke to her, nobody explained, so she assumed what she knew all her life. She's, by the way, in her mid-60s, so her life was a long life using a different system.
Yes.
And when you assume, you actually avoid the right treatment. So 3 weeks, fast forward, she already has complications of her first condition. She didn't take the medications on time. She bought the wrong insurance because she thought she just needed an insurance. So she bought something just to have insurance. It has nothing to do with the prescription. So everything went wrong. And this everything is not only a stress, not only a unneeded worries and whatever else, it literally harms her health. Instead of that, she would have just called. So she called 3 weeks later than needed, but
Oh, that's good.
but it's better than never. So we got a grip on it, and she's now treated. But again, this is exactly where things don't go so well. When you assume something from your past life, you don't know how it all works. It's all mixed up.
And if somebody wants to move to Portugal and there's so many options for medical insurance, is that also something that you guys can help with?
We do.
Like choosing the right one for them?
Choosing the right one. We aren't selling insurance. We are not brokers. But actually, one of the most popular add-ons, so-called, or the most popular asks on top of our basic services is assist me with understanding health insurance in Portugal and choosing the right one. Actually choosing what to do, or better said, what not to do. So yes, we will guide a person according to this person's specific medical background, needs, expectations.
Pre-existing conditions.
Pre-existing conditions,
Yeah.
give them a little bit of an understanding of pricing. This is another thing that is very different in Portugal. Like, what would you pay with insurance or without insurance? Not having insurance, maybe even.
Which brings me to public healthcare. Do you help people who are in public healthcare as well, or do they have to be
I think
private only?
no, they don't have to be private only. I mean, we help people, period.
Okay.
Because even when you are treated through the public system, you need a helping hand and somebody to support you. Our ability to influence processes within the public system is quite limited because of how the public system works. But here's the thing, when something doesn't work in the public system, we are there to help and to assist you, and sometimes to insist with the public system, and sometimes just to say, look, dear sir or madam, it just ain't working. So please consider doing something private. And as I previously kind of gave a hint, the price structure in Portugal is such that going private is not necessarily having to sell your kidney or go bankrupt. So this is where we come very, very handy. Let's discuss what's next.
This is very important because just last week I learned something. I've been part of Portugal for many years already, living here almost 5 years. And just last week I heard from somebody who's pregnant that you should really go to a public hospital when you're pregnant, because if there's complications that arise in the private sector, they still have to take you to the public hospital.
Yes and no, but again, here's the thing. A question that we came across literally last week as well. Maybe it's the same person. There's this concept of, oh, if something goes wrong with delivery, I have to be in a public system. Not necessarily. This is why you have somebody, again, that understands a bit to accompany you through your pregnancy. If the pregnancy is low risk, if everything is fine, if your baby is term, all good, all looks favorable, and you really want to have, in a way, a better experience in a nicer place, and you can afford paying, or you have insurance that is
Yes.
paying on your behalf, go to a private hospital, because here's the thing, if something bad happens, private hospitals do have the means and the ability and the equipment to stabilize the baby and the mom and whatever. And only in very, very extreme cases, it would be such a complex medical condition that the mom and the baby, or one of them, would have to be transferred. Yes, it happens. Does it happen a lot? Thankfully, no. If you do have a very high risk pregnancy, if something is terribly wrong, yes, public hospitals would normally provide you better care. The thing is that sadly nowadays in Portugal, not all public hospitals have obstetrics 24/7. Some of the obstetric ERs are closed, and so on and so forth. Again, another reason to talk to somebody who understands and can analyze together with you, what shall I do on my 38th week of pregnancy? Should I be still in my villa in Alentejo? No,
Probably not.
come to your aunt in Lisbon.
Yeah.
That's the thing.
It's very comforting knowing all this, that somebody is there for you, because as I say, it works completely different. I've had babies in different countries, and Portugal is very different and unique in the way that the health system works. So it's definitely, I think, crucial to have that extra team that's behind you and leading you in the right way to make the transition more easier. And speaking about transition, how easy or how hard would you say it is coming from a completely different country to Portugal and fitting into their health system?
It's quite easy as long as you do everything ahead, as long as you educate yourself ahead of time and you're not leaving healthcare to the last minute. I know that people naturally start their journey with legal issues and visas, and then comes the money, and then comes whatever else, and at the end, 2 weeks before arrival, wait, prescriptions. So if you just plan ahead of time, you ask questions and you ask the right source, and with all due respect to social media, Facebook isn't the right source all the time. But if you prepare yourself, and in terms of preparation, I'm not speaking about collecting and creating a stock of medicines, but rather speaking to somebody that can relate to your specific background. And again, this is the difference between somebody who understands what you're saying and somebody on Facebook that says, ah, yeah, you need a cardiologist. Sure, no problem. Cardiologists are all over the place. When you ask the right questions, you get reliable answers and you can understand how easy or complex would it be. I do have to say that after thousands, literally thousands, we have more than 6,000 people that kind of went through us, either stayed as active clients or just felt that they are independent, which is great. But over 6,000 people that we treated, there was one single case, one single person that the system here just could not treat what he had for different reasons. All the rest found themselves pretty comfortable and well treated. But what should not be done is like, I'm arriving next week and I have something that I thought was simple and apparently it's not, so now help me. This wouldn't work sometimes.
So,
So just talk to us in that case, ask questions. We will explain how it all works. You will come prepared. And when you land in a new country, you have huge amount of things on your plate. Healthcare can be off your plate for the time being in the hands of somebody that you really can trust, that would not let it slip into, between the cracks, but rather take responsibility and avoid any possible problem.
and being stuck somewhere without your prescription medicine. I'm sure it's not.
This is tiny little thing, really. There are things that are much worse, and we've seen it. So I'm really speaking out of experience.
Well, thank you so much for all this insightful information, Michael.
pleasure.
I'm sure it answers lots of questions for many of our viewers. Please, if you have any medical questions or want to find out more about Serenity, you can look for Michael. We will attach the website below, and you can ask questions, his team, and see how they are able to help you before your move to Portugal. Or if you are here as well,
Absolutely.
I'm sure you would help as well. So if you are here and you found yourself in a position where I was, where it's just different language and not understanding so well, please give them a call and they'll be happy to help you. Thank you for
Absolutely so.
watching.
Thank you so much. Thank you.
Thanks, Michael.